The effort, known as the Community-Wide Children's Health Assessment and Planning Survey, or CHAPS, is the first known project of its kind in our region to focus solely on children. Necessitated by limited data, CHAPS is a monumental endeavor aiming to evaluate children's health needs, identify children's health priorities, lead local collaborations in implementing solutions, create and monitor benchmarks to measure progress, share information and resources through the Center for Children's Health, and all with the goal of improving the health of over 600,000 children ages 0 to 14 in our region.
People don't want to believe that abuse happens, period. They especially don't want to believe that it happens in their own community and, God forbid, in their own family. But when they're forced to look at it and really face it, no matter how ugly it is, in order to prevent it, we have to first accept that it happens.
What we found in Hood County through the CHAPS survey is that throughout the 6-county region, the data showed that about 5% of families throughout the 6-county region had said that their child in their family had been abused, but in Hood County that was 15%.
As an educator, the impact I personally saw was in academics. They struggle when they are either abused or neglected. They have a hard time focusing and staying on task. Many students would come to school without enough to eat or proper medical care.
They suffer in school with grades. They're going to suffer with behavioral issues, acting out, maybe more aggressive. They might become more withdrawn.
We know children that are abused are much more likely to be in our legal system. And in fact, those that are in prison, 90% of them had some form of abuse as a child. So we know that, so that's going to cost society. They're much more likely to have problems with drug addiction and alcohol addiction.
It tends to be very cyclical, and it tends to repeat itself generation after generation. And that's one of the things that we'd like to try to prevent before child abuse happens, try to step in and figure out a way to stop the child abuse cycle from going on.
We are looking at parenting programs, and that can come through multiple agencies that offer parenting programs, and so that's a collaboration through multiple agencies. We're also looking at partnering between medical programs, parenting classes, mentoring programs, education programs through the school systems on reaching all these parents or potential parents.
And then we want to identify which populations are at highest risk of abuse and then focus on providing those families with some additional focused assistance and resources to decrease some of the risk factors that make them at risk.
We are excited about what we can achieve in Wise County because we do have good leaders there. People are interested in child abuse and neglect, and we are very excited about the prospects of what can happen in the future.
By providing a framework needed to tackle these issues, community members have the tools and resources to initiate action. With CHAPS in place, organizations and individuals interested in acting on the data now have a comprehensive resource that's available on the CHAPS website. For more information, go to chaps.org and click on Health Issues.